Hi, this is our Pathogen Project, and we're doing it over gonorrhea. My name's Taylor Black,
And I'm Madison Fanslow.
and we're very excited to teach you about this today.
Okay, so first off, we're going to talk about the scientific principles demonstrated. Bacterium in gonorrhea is going to be the one responsible for gonorrhea. This bacteria thrives in warm and moist environments, so this is going to affect any mucous membrane, such as your genital area, your mouth, your throat, your eyes, and your rectum. Gonorrhea is transmitted through sexual contact, but pregnant women can actually pass it to their babies through delivery. In the US, gonorrhea is most common among adolescents and young adults, but anyone can get it.
You're not safe. All right, so the major symptoms for males is a weird colored discharge, so that would be like white or yellow, pain or swelling in the testicles, inflammation or swelling of the foreskin. In females, it would be increased vaginal discharge, which isn't normal. You should always get that checked out, obviously. Intermenstrual bleeding, so bleeding when it's not your time of the month. In the rectum, it can be discharge, soreness, bleeding, pain during bowel movements, or itching.
So this is going to be a patient that was presented with gonorrhea in their bloodstream, so you can tell in their eye. It's all like red.
It looks like conjunctivitis.
Yes.
For a case study, the people involved in this case study was Michael Owusu, Kwado Sarfo Marpo, and Godfred Ekyompong.
Okay, so the case presented is going to be a 32-year-old female with a fever and generalized malaise. Blood and urine samples were collected, and she did get an HIV test, and it was negative. Her liver function markers, AST and ALT, were abnormal. So gonorrhea was actually isolated from the blood, and she recovered following ceftriaxone and erythromycin.
Gonorrhea causes sepsis and emphasizes the need for blood culture investigations and diagnosis of patients presenting with fever. So it showed scientists that when a patient has fever, we need to look into the blood because it's usually a problem with the blood. That's what it looks like in the mouth. As you can tell, that's pretty nasty, and it's not supposed to look like that. Gonorrhea is a sexually transmitted disease that is caused by a bacteria pathogen, Neisseria gonorrhoeae. It is considered very common by scientists, especially in the 15 to 24 year age group.
Okay, approximately 1.4 million new cases occur in the U.S. every year, so it's very, very common.
Yes, and over half of those are between that age group we talked about, 15 to 24, so it's typically young people, as you can tell. To prevent the infection, wearing a condom is always a good idea to prevent any of the infections, but better yet, checking to ensure your partner is clear of diseases is also important in preventing from any STDs. To treat gonorrhea, a person must visit a doctor, and they're typically prescribed ceftriaxone or azithromycin.
Okay, so the diagnosis procedure is when they suspect that they have an infection, they need to visit the doctor, obviously, and be tested through nucleic acid amplification test, and then the gonorrhea can be detected between 2 to 6 days. Then the doctor will prescribe drugs to fight off the infection. But gonorrhea will infect, most likely, your genital area first, but then if it stays untreated, it will spread to your joints and other body parts through the bloodstream.
Which then those parts will be infected and probably be painful, and then you'll have to have more aggressive treatment. So if a mom has it and gives it to her baby, which can happen, they have a high risk of contracting it, actually. If a baby gets it, it'll usually be characterized by what appears to be conjunctivitis or pink eye. As you can see in this picture, it's not good. And then they'll probably have to be treated with medications of some sort as well.
And that's another picture.
That's a more aggressive case there.
Okay, so the main management, CDC recommends a single dose of 250 milligrams of intramuscular ceftriaxone. So that's actually going to be like an injection, so a shot. And then 1 gram of oral erythromycin. Antimicrobial resistance is becoming a growing concern. So this is like you becoming resistant to the medicine. So it's going to make treating gonorrhea more difficult. These treatments will not fix any damage that the gonorrhea has caused. It's just going to like actually get the gonorrhea gone. So like the damage it did on its way there is not going to be fixed from the treatment.
So don't get it, basically. This is our, we're excited here. As you can see, we had a few really good sources. And that's all we have for you.
Thank you.
Let us know in the discussion if you have any more questions. We'll try to help. Have a blessed day.